Hello everyone, welcome to the CPT Guidelines tutorial series. In this video series, the first topic we are going to see is Evaluation and Management Coding Guidelines. So please follow my channel and check out my other playlist as well. Evaluation and Management Services Guidelines Part 2. In this part, we will see hospital inpatient and observation care services and consultations. So the hospital inpatient and observation care services covers services provided to hospital inpatients and to patients designated as hospital outpatient, that is observation status. Hospital inpatient or observation care codes are also used to report partial hospitalization services. It is divided into two parts: initial hospital inpatient or observation care for the initial encounter with the patient admitted to inpatient or observation status. Second part is subsequent hospital inpatient or observation care for daily management of patients on inpatient or observation status. So third category is hospital inpatient or observation care, including admission and discharge on the same date. The following codes are used to report hospital inpatient or observation care services provided to patients admitted and discharged on the same date of the service when the stay is more than 8 hours. So here you have to note that it is more than 8 hours. So if the stay is less than 8 hours, that is considered as office or other outpatient services. You can see this outpatient codes are used here. When the encode is 8 or more hours on the same calendar date, following codes are used. Less than 8 hours for different calendar date as initial patient hospital, following codes are used. And 8 or more hours, following codes are used. So when you do the questions, you can understand how these codes are used. And the fourth category is hospital inpatient or observation discharge services. This describes physician or qualified healthcare professional services provided at the time of patient's discharge from inpatient or observation status. So the code includes as appropriate with the final examination of the patient, discussion of the hospital stay, instruction for continuing care to all relevant caregivers, and preparation of discharge records, prescriptions, and referral forms. Okay, let's see some examples. So this is the continuation of first part. So question number 3. A patient is admitted to observation status for chest pain. The provider performs a comprehensive history, comprehensive examination, and moderate level MDM. Which code should be used? There are 4 codes available: 99,218, 19, 20, and 23. So please pause the video, take your CPT code book, and find the answer. Okay, in this case, you have to highlight a patient is admitted to observation and the medical decision making is high level, high complexity. So you can find the answer by several methods. One method, you can use the alphabetic index of the CPT code book. But for this evaluation and management guidelines, it is easy if you use the contents of the ENM services guidelines. So go to the ENM services content page and look at the contents table. When you come to the evaluation and management section, the initial part of the section having the table of contents. So here you can go to the hospital observation services. Here you can see observation care, discharge services, initial observation care, subsequent observation care. These codes are now deleted because the separate observation care is deleted and it is included in the hospital inpatient and observation care services. So you have to go to this part. I just show you. You can see the initial observation care 99,218, 19 have been deleted. So to report initial observation care, new established patient, see following codes. Similarly, subsequent observation care, those are also deleted. So you have to search this observation care in the hospital inpatient and observation care services. So for initial hospital inpatient and observation care, for the new and established patient, you have to go to the following code sheets 99,221 to 23. So let's go there. So this is the code description. When you go to the codes, you can see first part is initial hospital inpatient or observation care with low level of medical decision making. In our case, it is moderate level of decision making. So go to other code, initial hospital inpatient or observation care, moderate level of medical decision making. So this code is the most probable one. So the correct answer is C, 99,222. Question number 4. A 67-year-old patient is admitted to the hospital for management of pneumonia. The physician documents a comprehensive history, comprehensive examination, and high complexity medical decision making. What is the most appropriate CPT code for the initial hospital care? So there are four codes available: 99,221, 22, 23, and 31. So please take your CPT code book and find the answer. Okay, in this case, you have to highlight here the patient is admitted. So this is the inpatient, hospital inpatient, and the decision making is high complexity. So let's go to the book. As we done earlier, go to the evaluation and management section of the table of contents. Here you can see this is a hospital inpatient and observation care services. Here initial hospital inpatient or observation care. So you have to go to the new and established patient codes here. The decision making is high level. So when you read the 99,221 initial hospital inpatient or observation care, low level of medical decision making. 222 is moderate level of medical decision making, and 223 is high level of medical decision making. So when you read the code fully, initial hospital inpatient or observation care per day for evaluation and management of a patient which requires a medically appropriate history, endo examination, and high level of medical decision making. If the time mentions, you have to read other lines as well. When using total time on the date of encounter for code selection, 75 minutes must be met or exceeded. So this admitted with high complexity medical decision making. So the correct code will be answer C, 99,223. Let's go to the next question. A physician sees an established inpatient for follow-up on day 3. The visit involves low MDM, which code applies. So there are four codes available: 99,231, 32, 33, and 23. So please take your CPT code book and find the answer. Here you have to highlight this is the established inpatient and low level of medical decision making. So again, go to your CPT code book, evaluation and management guidelines table of contents, or evaluation and management, hospital inpatient and observation care services. Here, this is not the initial, this is the subsequent hospital inpatient care and observation. So you have to go to this code section. So let's go there. So here you can see subsequent hospital inpatient and observation care. 99,231 is subsequent hospital inpatient and observation care per day for the evaluation and management of a patient which requires medically appropriate history and examination and straightforward or low level of medical decision making. So in our case, it is low level. So the correct code will be 99,231. So the correct answer is A. So the rationale is subsequent hospital care with low level of medical decision making. Okay, let's go to the next question. Question number 6. Dr. Smith admits a patient for observation at 9 a.m. and discharges the patient on the same calendar date at 6 p.m. He provides a detailed history and examination with moderate medical decision making. Which CPT code should be reported? So there are four codes available. Take your CPT code book and find the answer. So here you have to highlight this patient is admitted. So this is the inpatient and discharges on the same day. So this also on the same calendar date. Moderate level of medical decision making. So this is the admission and discharge on the same day. So go to the CPT code book. Go to the section of evaluation and management part. Here you have to go to the hospital inpatient and observation care services. Here this part, that is hospital inpatient or observation care services including admission and discharge. This is happening same day. So you have to go with this part. So once you go there, you can see the following codes are available. So hospital inpatient observation care for evaluation and management of patient, including admission and discharge on the same date, which requires medically appropriate history and examination, and straightforward or low level of medical decision making. In our case, it is moderate. So go to next code. You can check here. This is moderate level of medical decision making. So code 99,235 is suitable code. So our case is admit and discharge on the same calendar date, moderate level of medical decision making. So the correct answer will be answer B, 99,235. Question number 7. A physician discharges a patient from inpatient hospital care after spending 45 minutes on the discharge process, including final examination, discharge instructions, and coordination of care. What CPT code should be reported? There are four codes available. Please take your CPT code book and find the answer. Here you have to highlight this is discharge from inpatient and time spent that is 45 minutes on the discharge process. So you have to go to the hospital inpatient observation services of discharge. Okay, let's go to the evaluation and management table of contents. Here go to the hospital inpatient and observation care services. This is a discharge service. So you can go down hospital inpatient or observation discharge services. So once you go to the codes, you can see the codes. 99,238 is hospital inpatient or observation discharge day management, 30 minutes or less in the day of encounter. So in our cases, it is 45 minutes. So the other code is 99,239 is more than 30 minutes on the date of encounter. So this code is possible. There's no other code. So if the physician or the caregiver spends more than 30 minutes or more, you have to give this code 99,239. So the correct answer will be answer C, 99,239. Okay, let's go to the third category of evaluation and management services, that is consultation. So consultation services refer services provided at the request of another physician or appropriate source for the purpose of rendering an opinion, advice, or recommendation regarding evaluation and management of specific problem. So in this case, the following must be documented. First one is request. A written or verbal request for consultation by another physician or qualified healthcare professional or appropriate source. Second one is render an opinion or advice. The consultant must provide an evaluation, an opinion or recommendation. And third part is report. The consultant must communicate the findings in the written report to the requesting party, consultant or the healthcare professional. So this consultation is divided into two parts. First one is office or other outpatient consultations. For consultation performed in an outpatient setting such as office or other outpatient site, including the home or residence or emergency department. Second category is inpatient consultations. So here for consultation performed in an inpatient hospital setting such as hospital inpatients, observation level patients, residents of nursing facilities, or patients in a partial hospital setting. So let's see some examples for this. So question number 8. A cardiologist receives a request for a hospital consult. The cardiologist examines the patient, makes recommendations, and reports back to the requesting physician. The MDM is high. What is the correct code? So there are 4 codes available. Please pause the video, take your CPT code book, and find the answer. Okay, in this case, you have to highlight a cardiologist receives a request for a hospital consult. So this is a consultation case, and the level of medical decision making is high. So take your CPT code book and go to the evaluation and management section. Here you have to go to the consultation part. So the consultation, you can see office or other outpatient consultation, but our case is in hospital. So you have to go to the next section, that is inpatient or observation consultations. So both new and established patients are looked at equally. So let's go the codes there. So here you can see the 99,252 is inpatient or observation consultation for a new or established patient which requires medically appropriate history and examination and straightforward medical decision making. In our case, it is high level of medical decision making. So the next code is low level of medical decision making. 254 is moderate level of medical decision making. So the 255 is high level of medical decision making. So when you read the code fully, 99,255 is inpatient or observation consultation for a new or established patient which requires a medically appropriate history and or examination and high level of medical decision making. When using total time on the date of the encounter for code selection, 80 minutes must be missed or exceeded. So for this case, the correct answer will be 99,255. That is answer D. Okay, this is the end of the part 2. So if you didn't watch the part 1, please check my playlist or the description for the other video. And please subscribe my channel and check my playlist as well. Thank you.